I saw 3 sunrises from within the Launceston General Hospital waiting room and only then was seen to by emergency staff.
In those 6 hours, my mum's pain became worse. She could not keep anything down. She died 5 days later.
No one had recorded how much fentanyl the hospital had administered. Luckily, the patient recovered from this overdose.
These are just a few of the stories that have come out of a parliamentary inquiry into ambulance ramping in Tasmania. While the committee has yet to start hearings, dozens of submissions from patients and healthcare workers have just been made public.
This is a harrowing read and it points to the absolute importance of this inquiry.
The submissions include details of a 93-year-old with a fractured pelvis who waited 3 hours for an ambulance and then was ramped for another 7. And a pregnant woman who was assaulted by her partner and had to be driven to hospital by the perpetrator's father because no ambulance was available.
The crisis in the health system and ambulance ramping is not only having a negative impact on the patients and the families themselves, but it's having an impact on health professionals.
They're telling us morale has never been as bad as it is today.
One health worker told the inquiry paramedics have been reduced to babysitters.
Their scope of practice is not designed for ongoing care in hospital hallways.
One of the most damning submissions came from the acting director of the Royal Hobart Hospital's emergency department, who said a lack of beds meant patients spent excess time in ED, leaving those who were trying to get in ramped in corridors. He said those beds are full because people don't have anywhere to go, making it a broader health system issue.
We recognise there's pressures right across health systems in every state and territory. There are very many front page news stories of challenges of an increasing demand on our health system right across the country.
The inquiry will hand down its recommendations early next year. Lucy MacDonald, ABC News.